You want to come and work in UK as a doctor, but you don't want to give any exams. No problem. I have got a great news for you. Today we'll be talking about Medical Training Initiative, commonly known as MTI, and how you can utilize this pathway to achieve your ambition of coming to work in UK. Of all the innumerable videos out there on YouTube, how this one is different. I'm currently working as a transplant registrar in UK and I'm on a pathway to become a consultant. I came here via Medical Training Initiative, and in this video I'll be giving you nothing but gold in terms of practical tips to utilize this amazing route to pave your way to this land of opportunity. And in the end of this video, I'll be giving you invaluable advice to land a job in UK via MTI route. What is Medical Training Initiative? Medical Training Initiative is a scheme that provides an entry route for overseas doctors wishing to train and develop their skills in the NHS before returning to their own country. The scheme aims to facilitate access to training equivalent to core medical or advanced specialty training for overseas doctors so as to improve the management and treatment of patients around the world. Who is eligible? Number 1, you must hold a primary medical qualification recognized by GMC and verified by Education Commission for Foreign Medical Graduates. Number 2, you need to have a postgraduate qualification such as MRCP Part 1, MD, or any other postgraduate qualification in medicine or medical specialty. And even if you have passed Part 1 examination in FCPS back home in Pakistan, that also counts for postgraduate qualification. Number 3, you must have a 3 years post-qualification experience. That includes 1 year internship as well as at least 1 year in the specialty in which you aim to train whilst in UK. Number 4, you must be in continuous clinical practice, and that means you should be working at least 3 out of 5 years immediately prior to getting your GMC registration. There should be no gaps in employment, and it is noteworthy that GMC doesn't consider clinical observation as a part of clinical employment. It is also important that you should stay in the clinical practice while you're going through the MTI application period. Number 5, you can't be sponsored if you have passed PLAB 1 and PLAB 2 or you have failed either of them. The Royal College of Physicians unfortunately wouldn't offer sponsorship in this case. Number 6 is to possess sufficient English speaking skills, and that can be demonstrated either by passing IELTS or OET. You need to obtain a minimum score of 7.5 overall in IELTS and 7 in all the categories. For OET, you need to have at least grade B in all the testing categories. Both IELTS and OET are valid for 2 years. Bonus tip, you can be exempted from IELTS and OET, but you have to meet 2 criteria. First, you should belong to a country as a national where English is a native language and practicing medicine in a country where English is a native language. What are the benefits of Medical Training Initiative? First and foremost, there are no hassles of exams. PLAB and MRCP involve hefty fees, have got considerable failing rates, and could be quite challenging to give in current waiting times due to COVID-19. With MTI, you can skip the queue and can start working in your dream job without having been bothered by the exams. Benefit number 2. Medical Training Initiative is one of the ways to get GMC registration. Once you have the GMC registration, this lasts for life. Your visa to work is 2 years, but the GMC registration you get is permanent and will not be revoked after the end of 2 years. Benefit number 3, you get equal or even more training opportunities compared to your fellow peers. This, of course, depends upon your knowledge, confidence, and clinical skills. You will have an online portfolio and supervisor who will look after your progress and ensure you're thriving and ticking all the boxes. Benefit number 4, and I really like it. While working as an MTI, you can apply for postgraduate qualifications such as MRCP and subspecialty certificate examinations. You will have a better chance on passing as you're already working in NHS system, hence getting more familiar with the clinical scenarios that you're often tested in these examinations. The fees will be less bothersome because you will be getting paid in pounds, and you can even claim reimbursement via your study budget. Benefit number 5 is a bonus tip which most people don't know about. While working as a medical training initiative, you can apply for Diploma in UK Medical Practice. It only costs £750 and it is considered as a postgraduate qualification. It helps you develop skills outside of clinical practice, including teaching, quality improvement, and clinical governance, all important aspects of working in the NHS. This is a valid postgraduate qualification to showcase your high standard of performance and may support future career progression. So what are the downsides of medical training initiative? The greatest drawback is that you come on a Tier 5 visa. This essentially means two things. First, at the end of the 2 years, you are supposed to go back home. You can't stay in UK to switch or extend your visa. The second drawback is that if you want to come back to work in UK long term and you want to settle in UK as a national and get a British passport, these 2 years spent on a Tier 5 visa won't count towards that. As you know, for an ILR, you need to have at least 5 years spent in UK. Unfortunately, if you have come initially on a Tier 5, that would actually mean 7 years in total. How to land a job via medical training initiative. By now, you know the advantages, disadvantages, and the requirements, and you want to come and work in UK because you tick all the boxes. So how to attain a job in UK via this route? There are 2 ways to get a job via an MTI. Some specialties have established programs that match you to a job. This is common in specialties such as anesthesia, gynecology, emergency medicine. What you need to do is to go to the respective Royal College websites and search for medical training initiative. I have included the links in the description where you can search more for yourself. Essentially, they will run these programs on specified dates every year. Matching can sometimes take 12 months or more. Also, keep your eyes and ears open and ask around within your own country. For example, in Pakistan, they run a dedicated medical training initiative program through College of Physicians and Surgeons of Pakistan that regularly send people to train in UK. What's the other way? The other way is to find a job all by yourself, a job which you like and a job which you like to do. So where you can find these jobs? You can find these jobs on websites such as BMJ Careers, The Lancet, NHS Careers, and NHS Jobs. You go on these websites, look at the job you want to do, apply for it, get shortlisted, get selected in the interview, and once you have landed the job, you write to the respective Royal College and request for a sponsorship via an MTI route. Drawing conclusions. MTI aim to share knowledge, experience, and best practice which would benefit you who gets training and development from NHS, your home country, to which you will return with knowledge, skill, and experience, and the NHS, which has spare training capacity and unmet gaps that would be filled with skilled doctors from overseas. If this video has proven useful to you in any way, do press that like button. It really helps me. I regularly make these helpful videos to help doctors who want to come and work in UK to pave their journey and make it as seamless as possible. So do subscribe for more. Until next time, take care.